Hi. So to record myself, I'm going to use my boss's office because it is too loud in our break room. Too many people coming in and out when I'm doing my actual presentation. So I'm just going to do exactly what I did in the break room in my boss's office. So first, I'm going to do a review of the first in service, which signs of impending violent behavior. Objective signs are flushed or pale face, excessive sweating, clenched jaws or clenched fists, pacing or other repetitive movements, change in voice volume or tone of voice, glaring or avoidance of eye contact, change in facial expressions like scowling or sneering, shallow or rapid breathing, and these can be present in patients, visitors, or staff members. Other signs of these can be patient states that they feel fear, anxiety. They could be argumentative with staff, have a loud volume to their voice. They can invade the staff's personal space. And here's a few tips to avoid acts of violent behavior. Talk to the patient or visitor or a staff member in a quiet, low stimulus environment. Actively listen to the patient or the visitor. Ask narrative questions, not yes or no questions. Keep the communication open. Maintain full eye contact. Let the patient and visitor tell their full side of the story before you give any kind of opinions. Next, I'm going to move on to the second in service. And here we go over risk factors for potential violence. And these are more of where you work, your type of job. So working with the public puts you at high risk for violence. Handling money or drugs, valuables, etc., which we all do in the emergency room setting. Working with unstable patients, again, in the emergency room, pretty much every patient you have is going to be unstable. Working near a premise where alcohol is served. Working in community-based settings, and working late hours, early morning hours, or on or near holidays. Those are all risk factors for violent behavior from patients, visitors, staff. So a few preventative measures for violence include always have an exit and keep nothing between yourself and the exit. And you also want to maintain a comfortable posture with the patient. Don't cross your arms, don't put your hands in your pockets, don't constantly be looking at your watch, like you don't have time for the patient or the visitor. You want to get on their level when you speak to them. And only go into areas with adequate lighting at night or areas that are security guarded. If you don't feel safe, always ask a security guard or an escort. Use the buddy system, never walk alone. That's what a lot of us here do. We always walk to our cars together when we leave, and we always walk in together. We'll wait in our cars, and then we'll cross the street and come in together. And don't ever enter any kind of situation that you don't feel safe in. But sometimes violence is inanimate. It's going to be violent whether or not you want it to be or not. So in those instances, ways to de-escalate the violence is to use verbal communication techniques that are clear and calm. Staff attitudes must be non-confrontational. Avoid using abbreviations or healthcare terms. Talk on a level that the patient understands. Use non-threatening body language. No crossing your arms, hands in your pockets. Don't act like you don't have time for the patient. Approach the patient or visitor with respect. Be supportive of their issues and their problems. Don't brush them off, regardless of how stupid you think that it is. Respond to the patient's expressed problems or conditions. This will help create a sense of trust between you and the patient. If you respond, and even if you don't care, you act like you care, then the patient will feel better automatically. To set clear limits for the patients and the visitors to follow. If there's clear limits set initially, there will never be a question as to what is expected behavior-wise. And also implement environmental controls such as minimize lighting, noise, and loud conversations. If you have a patient that's already showing objective signs of violence, their jaws are clenched, they're sweaty, they're pacing, don't put them in the hallway, for example, where their violence is just going to escalate out of control. And if all else fails, sometimes you have to get security involved, which unfortunately only escalates the situation further typically. And the police may have to be called as well. Those are some things that we may do here. And depending on the situation, we may also use restraints, whether that be chemical or physical restraints. Just depends on the patient or the visitor. So those are some risk factors for violence, preventative measures, ways to de-escalate, and some signs to always keep in mind anytime you're taking care of a patient. And it's always a good idea as well to, if you're ever feeling like a patient has the potential for violence, but they're not necessarily showing these signs because maybe they have a history or a history that will put them at risk for being violent, like drug abuse or psychiatric, any sort of risk factor. It's always good to alert someone else or alert the nurse that's going to be taking the patient or the doctor or anyone in that environment. That way they're aware as well. And now I'm going to do some questions, and then I'm going to do the end video. So now we're going to do a couple questions. Can you verbalize to me 3 objective signs of impending violent behavior?
Maybe they have clenched jaws or clenched fists, excessive sweating, and maybe they are pacing or tapping, repetitive behaviors.
Okay. Is there anything else that I didn't cover in the in-service that you think might be a potential?
If the person, maybe they're disengaged, they're quiet.
Or they don't want to talk at all.
They don't want to talk to you. They're not answering you.
Okay. Now what about... Let's see. What are 3 ways to de-escalate violent behavior?
You should approach the patient with respect and be supportive of their issues and problems. Set clear limits for the patients to follow, and then use non-threatening body language.
Okay. Can you give an example of how you've de-escalated a situation before that's maybe not listed on a handout or my in-service?
Sometimes when patients come in with visitors or when there's somebody with them, that person might be the person that is causing them to be agitated. So separating them from that person or something like that, that would de-escalate the violence in the situation.
What about an object? Do you think that sometimes patients get more...
They don't like their phones.
Yeah, agitated
Right.
because of their phones. Okay, so let's see, what else? Can you give me 2 preventative measures, ways to prevent violence? Or prevent an act of violence maybe before you even think about it occurring, just to avoid that altogether?
Well, don't go into any situation if you feel uneasy or unsafe. And you always use the buddy system, don't be alone.
Okay.
If at all possible.
Do you always try to practice that?
Try to.
Okay, well, do you have any more questions for me or anything?
Appreciate it.
All right, that's it.
I've got to reschedule because of your screw-up. I have an appointment now, and I'm going in now.
Mr. Ward, I really can't let...
Workplace violence is a serious safety issue. Some 2 million American workers are victims of workplace violence each year. It can surface in the form of verbal threats or even physical assaults. But no matter how workplace violence manifests itself, it is undoubtedly a growing concern for employers and employees alike. Here are 7 tips to prevent workplace violence. Assess your work environment. Critically examine all areas of your work environment, including parking lots, entryways, reception areas, work areas, and offices. Is the lighting adequate? Are there convenient escape routes? Do you have a method to summon assistance? Pay attention to the warning signs. Many people who become violent communicate their intentions in advance. Threats from customers, coworkers, or third parties should be reported immediately. Promote respect. The best way to prevent violence in the workplace is to foster a day-to-day attitude of respect and consideration in your work environment. Eliminate potential weapons. Take a mental inventory of objects available in your immediate work area that could be potential weapons. Remove or secure objects that could be thrown. Know your violence response procedures. Violence response procedures are simple plans designed to minimize injury during a violent incident. These procedures should include a plan to summon assistance and move people to a safe area. Trust your instincts. Don't ignore your internal warning system. If you sense impending danger, react accordingly. Use a team approach. If you are in a situation where hostility could occur, use the buddy system.